afternoon. My name is Jonathan Lindley, and I would like to talk to you just a little bit about accessing healthcare and how Americans can access healthcare. And I feel, have a problem in America, and that is not enough people are able to access healthcare. Many Americans face barriers that prevent or limit access to necessary healthcare services. For example, inadequate healthcare coverage is one of the largest barriers to healthcare access. As well, on that thought, in 2022, an estimated 25.6 million non elderly adults were considered uninsured or underinsured. And while items such as the Affordable Care Act have worked to help alleviate some of this burden of being uninsured, there continues to be gaps in the availability of coverage to all Americans. So, as I mentioned previously, one method of achieving access to health coverage is through making coverage more readily available to all persons, such as the Affordable Care Act. And the ACA works to make health insurance coverage available to more people by providing things such as tax credits, a marketplace for insurance coverage, and expanding Medicaid options. This program is able to be modified through additional legislation, such as the passing of the recent 2024 Notice of Benefit and Payment Parameters Final Rule. And so, what this does is it increases the types of services available, such as behavioral health or substance use treatment centers, to people who are utilizing the marketplace for purchasing insurance or people who are on Medicaid. A different approach, but one which still seeks to make healthcare more accessible to people, is something put out by the American Academy of Family Physicians. This is a primary care based health framework called Healthcare for All. And the AAFP's model combines some traits of a variety of different universal healthcare programs that you see throughout the globe, such as availability of care for all persons through a multiple payer system with a reduction in costs for the patient, and then extensive state and federal mandates to provide reasonable coverage. Modification of the ACA or introduction of a program such as the American Academy of Family Physicians. These programs occur through what I would call the typical legislation process, where a bill is introduced to Congress, sent to the president to sign off for the executive branch, and then oversight is provided by the judicial branch. And if you're like me, you might be familiar with the television series Schoolhouse Rock, where we see Bill here who describes this process a little more in depth than I'm going in this video. The best approach, I feel, is that the AAFP's Healthcare Plan for All, just due to the availability of coverage for all people, as opposed to where the ACA only provides coverage for certain people based on maybe financial need or disabilities or other criteria. However, the ACA and the additional legislation modifying the ACA is what the federal government currently supports. And frankly, only time can tell us what direction healthcare and American healthcare policy may take. If you would like to learn more about anything discussed in this video, here are the references I used today, and I appreciate your time. Thanks so much.